I'm really proud to introduce you to one of the people who helped me personally, who I have referred a few people to, especially if they're in the right geography, and is part of the underlying wisdom that has helped me to see what it is that I can do with my expertise to help folks who have come into my world. So, so we're ready to introduce Dr. Amaliya Santiago, whose name I think I have misspelled. I think we have a typo in there, perhaps. My apologies. um, Dr. Santiago is a naturopathic doctor, which focuses on complementary medicine, and she's got a huge depth of expertise there, um, and is going to help us today to understand a little more about, what is this mainstream medicine? What is this complementary medicine? And how do we even think about um, working and guiding our personal medical journey with the help of this kind of expertise? Dr. Santiago, if you would kindly introduce yourself a little bit more, and maybe just tell us a little bit about how you think about complementary medicine.
Sure. Thank you so much. And thank you for welcoming me to speak at this wonderful conference. Or summit. I really appreciate the camaraderie or the joint efforts to bring knowledge to people that need it. So that's really great. Let's start. Now, before we start, do you want me to share the screen, or do you want me to, okay, can we do that? Would that be okay if I put up the slides and we start?
Yes, let's
do that. All right, give me one moment, please. Okay, I'm not sure if that worked. Let's see. Oh, I see. All right, now we can see. Right? Can you see now? Perfect. Well, welcome everybody. Thank you for a great introduction. So I'm Dr. Amaliya Santiago, and I'm a naturopathic medical doctor, and I practice integrative natural medicine. And what that is I'm bringing together both conventional and natural therapies that work for any conditions, not just oncology, but I do specialize in oncology and naturopathic support for oncology, or complementary support for oncology. I do also pain management and autoimmune conditions. Sometimes those can also lead to cancerous conditions. So they've kind of all meshed together. In addition to that, I do primary care for a lot of patients that may not have a chronic condition, but they're coming in to prevent. So prevention is also big on my list. My practice is in Pasadena, California. The address was on that previous slide. I'm in Southern California, and I do phone consults also for patients that may be needing support, but physically can't be in my clinic. So there's so many different avenues of getting support you'll need, or maybe even referral. All you need to do is reach out to the right contacts, like our clinic, for example, and then we'll go from there. So let's go to the next slide here. I'm a graduate from Bastyr University. And we have a couple of campuses now, both in California and in Washington. And for those of you that may not know what naturopathic medical school or naturopathic medicine is, it combines, so in our modules, as we're learning, we learn everything that you would learn in regular medical school, but in addition to that, we get herbal support and homeopathic therapies and physical medicine. So we kind of combine a lot of the natural therapies. Hydrotherapy is another one, and nutraceutical therapies. So the goal for naturopathic doctors like myself is to make sure the therapeutic order is kept. So we always first do no harm. That should be for every doctor. And then use the lowest therapeutic order for treatments. For example, diet and lifestyle is really big on our list. We start there. A significant high percentage of conditions start from just diet alone. So there's a lot of support, a lot of effort on nutrition. And in your summit, you've gone through this mind and body, spirit support also. It's very important. And in addition to those, in my clinic, what I'm offering for oncology is IV nutrition and other therapies, and I'll list that on the next slide here. So before I get to that, the agenda here is to talk about the therapies that are being offered, and I'll talk about complementary versus conventional therapies. Again, as I mentioned, diet, exercise, stress reduction, and then I'll have time for questions if you have questions at the end, or even during. You are welcome to stop because there aren't too many participants that are during the talk, as some will be listening to this. But if you wanted to have questions that are relevant that can't hold until the end of the talk, please interrupt me and then I'm happy to answer them. So different therapies that are being offered. Bioidentical hormone replacement therapy is something that could be used for patients that are not on hormone suppressive chemotherapy drugs for cancer, for example, for breast cancer or for prostate cancer. That may not be the case, but for other patients that after radiation or chemotherapy, the hormones are altered, that could be very helpful therapy. And then diet and lifestyle modification, I'll talk a little bit about that. Exosome and plasma-rich platelets, really I offer that in a clinic for pain management, but there have been so many controversial talks or studies about stem cells inducing cancer growth that it's case by case basis. So I would have to address the patient and see if that would be something for, if it would fit the oncology cases. And then hyperbaric oxygen chamber is really big. If you haven't learned about that, that's a very big therapy in oncology, especially in integrative oncology. Hyperthermia, ozone sauna, of course, various IV therapies that are supportive. We do in-house labs. And then ozonotherapy, prolozone for pain management, also for scar tissue healing. That's really important after surgery. And then peptide therapy, pulse electromagnetic therapy, plexor plasma, and vessel health. So I wrote these out because these are all therapies that I do offer in my clinic, in case you were wondering. And then the big challenge is when you're diagnosed with cancer is to figure out what to do. It's just so many conflicting information that you're going to find online. The first thing you do is you want to be resourceful for yourself, right? Research and figure out what's going to be helpful, what the do's and don'ts are, how do you select an oncologist, how do you find integrative support and such. So the main challenge that I see with patients is getting the oncologist to approve the complementary therapies that are recommended by doctors like myself. So the therapies that I'm going to speak for myself that I'm offering in my clinic are extremely safe while you're going through cancer therapies like chemotherapy and radiation, and then afterwards also. The big concern for everyone, myself, the oncologist, and the patient is, was this going to make my cancer worse or is it going to help me? I have yet to see a patient that's gotten worse with the treatments that we're offering. That's never the case. So yes, there are a lot of theoretical research studies out there that may say, listen, antioxidant therapies may be conflicting with the therapies that are being offered, but that's not really what's going on in clinical settings. So these are topics you can discuss with your integrative doctor whenever that's coming up. So I would highly recommend not to use fear as a place that you would come from, because that's very common and it's very natural to be fearful, but to really first of all, trust your doctor, both the oncologist and your complementary doctor, and then possibly have them work together. I have not seen too many oncology doctors that may not even have the time to cooperate or go over these things with the complementary doctors. But I will tell you that as a naturopathic medical doctor, and the background that I have, and the research, the schooling that we get, and then the postgraduate continuing education that we get, safety is always first. So I'm harping on this topic so much is because that is one of the biggest determining factors for patients to reach out for complementary therapies. So they are safe, they are very supportive. Let's see, hold on one second. I want to see. Okay, I'll come back to that. So what I wanted to say is I think I may have a slide of why complementary medicine. It gives you quality of life, it gives you longevity, it puts you in remission. You can continue working. As you business owners that are diagnosed with this condition, you need to keep going. You know, you can't ask for time off from your employer. So in order for you to continue, you need to have you need to balance your health, your condition, and your business. So you're very different patient than the regular oncology patient, as you may have experienced. So these are therapies that are going to help you get the support you need to get through the day or through the treatments, through the cancer until you're in remission. So I talked about diet and lifestyle. That is one of the most important things, changing the mindset, getting out of the fearful state and learning how to carry on with the diagnoses, but be more grounded or have more control of what's going on. And then you get empowered when you know that, okay, at least I know if I change my diet, I'm going to prevent the contribution of the growth, for example, and I'm going to at least help while I'm going through conventional therapies to shift in the right direction and go into remission. So that becomes empowering when you know you can do that. And also, and I'll talk about exercise, why it's important in a moment, but exercise is, I always say, I wish I could put it in a pill form in a capsule and give it to patients. It's that important. It's a therapeutic treatment and we all can do it. It's free to us. And, you know, we're all human and we all make choices every day and we prioritize, and exercise always ends up being last. But I would highly recommend, these are things to do. And I always talk about that at the clinic when patients come in. Nutrition, and when nutrition is a little different here, it's not just the food, but also the supplementation that become extremely important while you're going through chemotherapy and radiation. Immune support, metabolic support. I mentioned immune support and metabolic support here because cancer is an inflammatory condition that lowers immunity, and you know there's this metabolic dysfunction that happens, and if you get these particular systems supported in your body, you will see a shift in your health towards better. Let's see. Yep. So dietary modifications, what needs to be done right away if, can I go back? Yeah. Okay. The importance of dietary modifications is we go through our life as we get older. Obviously, our nutrition can get better, but we're not mindful about what we're eating. We eat because it's time to eat or we're hungry, and then we carry. If you're a business owner, I'm speaking to from one business owner to another, you know, there are sometimes that it's already 8 o'clock at night and I haven't had a meal because I've been so busy or consumed with work. These things can happen, but it is so important to eat quality food. I can't emphasize that enough. I'd rather you skip a meal than to eat crappy food, because crappy food is it's only going to make things worse, not better. Food is extremely important. So completely eliminating processed foods, getting rid of refined foods, big dietary factors I remove for reducing inflammation is dairy and wheat. Those are big. And any foods that cause allergies, reducing high salt foods is very important. I'm not going to go through step by step, but these are things that have kind of become common knowledge, but it's still very important to focus on because if you don't remove these, you just don't get better. It's that important. And then I put this slide up, and then there's the website ewg.org, because that's where the information gets updated every, I think, 6 months, at least once a year anyway. But these are the foods, the dirty 12 or the clean 15. Those are the foods that the dirty 12 is what the foods you want to eat organic, because our government updates this list based on the herbicides and pesticides that are being sprayed. So the more toxic they are, the more likely they are to end up on that top 12 list of the dirty foods that is recommended to eat organic. So I bring this slide up. I'd rather you eat organic all the time, but some patients will say, look, it's just not in my budget, or it's just not convenient. You're out in a restaurant, and now what are you going to do? You know, it's hard to find organic restaurants. You know, it's not always available. So be mindful about the foods that you must eat organic in order to prevent a toxin overload. Not only you have the daily toxin overload, but now you're getting chemotherapy and you're getting radiation, you're increasing that toxin. So your liver has to cleanse all that out. So the less you burden your body with that, the faster you'll heal from your treatments. Okay, let's go to the next one. So I talked, there's a few slides here about ideal diets for cancer. So if you've done any research about what diets or what food I should eat, there's so many. There's a keto-friendly diet that's very, ketogenic diet is now very popular in oncology because it's very low in carbohydrates, higher in protein, and if you're eating clean, it's higher in nutrition in that way. However, I will tell you that, before I get to keto, plant foods are very important. Berries are extremely important for your immune support. The proanthocyanins is the word I was looking for. Really, the berries that are rich in proanthocyanins, which are they help with your blood vessel support. They overall are so good for your immune system. And then fish is better because they're less inflammatory than meat, even though they're all protein. So I don't recommend to stop eating meat, but I will say that if you have options, seafood would be a better choice to lower inflammation in the body. Mediterranean diet is a wholesome diet that's important. I was talking about keto a moment ago. Ketogenic diet can lower some of your electrolytes. They can lower some of the vitamins that you would get from a variety of fruits and vegetables that may be higher in carbs than they're keto friendly, but they do give you nutrition. And eventually, if you don't eat those foods, you will become nutrition deprived. You'll get muscle cramps. You won't feel good after a while. So I always say, if you are doing the ketogenic diet, you either have to take supplementation or IV nutrition, or do short bouts of them and then switch to either Mediterranean or pescatarian diet, because they're wholesome and you can get the nutrients from it. It is important to get proper nutrition. Alkalizing diet, acidity and alkalinity has been a big thing in oncology. Lowering the acidity is great. Drinking alkaline water, I'm not a big fan of. I wouldn't recommend it. Drinking normal pH water is better, around 7. And the alkalizing diet, these are some of the foods that can cause your gut and body fluids more alkaline. And that's really important because there is acidity involved with cancer and you want to reduce that. So if you were to eat the wholesome diet, some of the dietary recommendations here, you would naturally be on an alkalized pH. Best foods to eat. I put soy on top of this list on purpose. Soy is a very controversial food, especially in breast cancer and prostate cancer. Yes, it's true if it's genetically modified and if it's non-organic, because then you will have problems. You will be an endocrine disruptor. But if you're eating clean, organic, non-GMO soy, it actually is helpful. It has phytoestrogens in it, but it is more therapeutic than harmful. So I put that on there so I could have that conversation. Now, it is your choice whether you want to include soy or not. If you're nervous about it, fine. But if you have to eat it, or if you've eaten it, I don't want you to lose sleep over it, as long as it's clean again and it's not genetically modified. Flax is rich in fiber It is great when you have constipation, and we all know that happens to be on top of the list usually with some of the medications or painkillers you're taking. Rosemary is great for memory. Oolong tea is anti-cancerous. Fish is excellent for your brain health and overall lowering inflammation. Curry is a great spice to use as anti-inflammatory, and so then the rest of the foods are very supportive. Mushroom is a big one. I also give mushroom supplements to my patients because they have affinity to increase your immune system, and that's very important. They increase natural killer cell activity. Cruciferous vegetables are very important. So the cabbage, the broccoli sprouts, the cauliflower, those are excellent to eat. And then just overall guidelines here, a summary of foundational diet plan will be to eat adequate protein. And this is 0.45 to 0.9 will be, actually it's gram per kilogram. So sorry about that. It's gram per kilogram per day. So it's not supposed to be 0.9 grams. So you'd calculate that per your body weight. And there's a lot of protein calculators online you can use for your body weight. I'm happy to help with that if you have any questions. Eat 7 to 8 servings of fruits. Of course, you want to pick fruits that are lower on glycemic index. For example, if you're eating 10 bananas a day, you might not be doing yourself a favor. But if you were eating different varieties of fruits, then that would be a good thing. And then grapefruit is another one that doctors like myself will always say to be careful with, because grapefruit can enhance the absorption of medications you're taking. So with certain medications, it's always recommended to be careful with that or to avoid it. Drink half your body's weight in ounces of water is very important. You want to flush out a lot of the toxins. Also, when you're going through chemotherapy, you're causing cell death with chemotherapy, and that becomes a toxic state in your body. That's why you're not feeling well, you're fatigued, you have brain fog, and pain even. So to clear that, water is very important. These are things you can do at home. Increase consumption of fish oil, omegas, all DHEA, EPA. So fish, flax, nuts, seeds are very important. Avoid simple sugars, refined carbs, eat organic, unprocessed foods, non-genetically modified, eat only wild-caught fish if you can. Consume at least half a cup of the Brassica family foods. They have sulfur in them, and that's really helpful for your liver to actually detox. Again, the phytoestrogens I talked about earlier, soy happens to be one of them. You can eat them. They are protective. Again, if it's non-GMO and organic. Avoid saturated fats and trans fats, and eat more healthy fats. So olive oil, avocado oil, nut oils, ghee, butters, great, and fish oils, of course. Dietary supplements as directed by your primary care doctor or your naturopathic doctor or your complementary doctor. Reduce or eliminate alcohol. This is a big one too. Some of my patients are like, look, I want to keep some normalcy in my life. Can I have a glass of wine at night? Sure. That's not going to break you here. But some patients prefer not to because they're not feeling well already, But if that was something, that's your vice and that's what you want to go to. I'd rather you had a glass of wine than had Coke, for example, or soda. Limit fat to 30% of your total calories. This is for certain cancers, not all cancers. For brain cancer, for example, that would be higher. So those are things that I would recommend seeking medical advice on that. Exercising is extremely important to reduce anxiety, to reduce depression, to reduce body fat if you are on the overweight side, because that is important too, to reduce inflammation in your body and get healthier, reduce pain. And you get that blood flowing throughout your body, you're going to help in the detox pathways and heal faster. It is so important. So these are some things that it does. It also improves sleep. That's another one that's really a big one. Oh, also strengthens bones. Let me talk about that since I put that in. One thing about going through chemotherapy or radiation, I would recommend asking your doctor at some point to do a DEXA scan, even when you're done with all treatments, because some of these therapies can cause thinning of your bones, and you can be in osteoporosis state like a 90-year-old, but you're only in your 40s or 50s. So I would highly recommend doing that and getting bone support, vitamin D, getting adequate amount of that, the calcium, or the other nutrients for bone, or strontium, boron. These are all in formula for bone health that you need to take. I wouldn't recommend jumping straight into getting Fosamax injection, for example, for it. That may be too much. That I wouldn't do, but I would definitely say keep an eye on that. Make sure you don't have it. If you do have it, there's a lot of natural support you can get for it. Sleep is another one. Anxiety keeps patients up. I have a lot of support for that. CBD oil really helps. I'm not a big advocate for drugs, but I think CBD has been extremely helpful for a lot of patients to also increase appetite. That's another one if patients have suppressed appetite, or enhance their food intake. Stress management, there are a lot of herbs. These are the most popular herbs that I put down here. Very important. Lowering stress is half the battle. So how do you do it? You've got this awful diagnosis, you've got your business you're running, you've got all this going on. So you have to mindfully, meditation, exercise, taking some nutraceutical support. Prayer is great. Finding the time to do things you enjoy, even for 30 minutes a day, could be really great. Stress reduction, taking your pet for a walk, spending time with animals. These are all, in your garden. You find your zen, find what works for you and do that. You don't need to incorporate something new that's going to cause more stress. That's not what this is about. This is about doing something that you're within your comfort. Some people love yoga. Some people will never go to a yoga place. You find what's good for you. Tai Chi is great. There's so many options for reducing stress, and it's extremely important. So there are some supplements that are very popular. I wrote them down that may be working. I wrote down 20 milligrams for melatonin. That's a really high dose. There's no danger in taking 20 milligrams of melatonin at night. The reason why I put that dose down, 3 milligrams is all you need for sleep. 20 milligrams improves your natural killer cell activity, enhances your immune system. Since if you're going to be taking melatonin, you might as well take a 20 milligram dose to help with that too. And then there's some botanical support. These are some common ones. You can also find these in tea form that you can take, make a ritual, when you get home, to have a glass of tea. Or I wouldn't recommend it right before bed, then it's going to wake you up to go for urination. But throughout the day, tea is very helpful. It's a lot better than doing caffeine. Although if you are a coffee drinker like myself, 2 cups of coffee a day is fine. Past that, then now you're really pushing your adrenals. So then here's the big one. Why combine conventional with complementary? The big question: to improve quality of life, for remission, longevity, to get supportive therapies, symptom reduction, elimination, and just be empowered by that. A lot of patients come in and they see me, they say, I felt like I had no hope. All of a sudden you've given me hope. And this is very important. You have to have a goal in your mind to have that, your end goal is I'm going to get better, and I'm going to continue with my life, and I'm going to put this behind me. And that's really important. This is the kind of support you can get from from complementary therapists, also conventional docs that, we're all here to support you. I think that's it. I am happy to take questions here and to focus on certain topics that you may have. We're open for discussion. Please feel free to ask questions.
I do have a couple of questions for you that I've taken notes on, but I wanted to give a minute for other folks to chime in, because it may take a little bit. And also, this might be a good opportunity for me to say that our speakers in this summit, and also the people attending, some of them do have personal or direct family experience with cancer or with similar things. Sometimes they have seen friends and colleagues go through it, and have those kinds of reasons for being interested in this topic. So I don't want folks to feel like any particular speaker does or doesn't have background other than what they have verbalized. And for you, if you want to make a comment, um, this is not a place where we're going to assume, or a place where we're going to be, have a big reaction um, to the fact that you have a question on this topic. Some people get fearful or just feel private, and that's fine, but still feel free.
So there's a couple of questions that have come up. Well, one is a comment, the other question says, so is alkaline or hydrogen water more of a fad or overrated? That's a hard one to answer. So listen, I would focus more on nutrition than the water aspect of it. I do think you should, more importantly, is to get hydrated than to select what type of water you're going to drink. So hydration first, if I was to prioritize. Then I would say drinking clean water, so filtered water, or having it, like, for example, I have a Berkey filter in my home or in my office. It's really important to make sure that it's remineralized, but it doesn't have the fluoride, the chlorine in it, and all the junk that is going to have an extra burden on your body. So we'll start there. As far as hydrogen water, I haven't, my personal opinion here, I haven't seen that big of a difference both with patients and myself. Some will come in and rave about it, but I'm not seeing that over the board. So usually I look at the big picture, right? If one person is talking great about it, but then 10 people are like, I didn't see that big of a difference. So that's not something I'm going to jump to and recommend, because you also want to stretch your resources in the right way, because no one has unlimited resources here. You want to choose all your choices carefully to have the most support, and that's always the case. So that's that. And then the alkaline water, I wouldn't recommend it long term. If you do drink alkaline water, you constantly causing a pH shift in your gut, because that water has to go through your stomach first. So initially, if you're too acidic, it may feel great, but after a while, you're going to start having gut issues, which is always the case with patients. I'll say, look, I was feeling well, and then all of a sudden, after a while, maybe a month or two into it, I'm starting to not feel so well. We'll stop the alkaline water then and start drinking regular pH water. I'm always towards balance and towards what your body really is at optimal. An optimal pH is around 7, not alkaline or acidic. So if you're acidic and you take alkaline, you're bringing it back to the normal pH, and then at some point you have to stop. We have some strips so you can check your salivary pH, your urine pH, and get some form of an assessment where you are. Some patients are just fine, and some will be more acidic. And I wouldn't recommend doing it after a meal. I would do it, first thing you wake up in the morning would be the best time, or right before bed, to where we can get a better assessment of the acidity of your fluids. The regular pH strip you put in your mouth or even pee on it will show you the acidity or the neutrality of it. Good. And then I do agree that incorporating functional integrative medicine is really important for quality. I can't tell you how many times patients have come in and have said, I was feeling so bad, and all of a sudden after treatment, I'm feeling so great. Or ever since I started following the recommendations, it's shifted my life. And this is why I do it, because I want to see a difference in patients. How mainstream is to have complementary medicine? What percentage of patients? Well, all my patients that come in, so it's kind of hard to answer that, but I am seeing more and more patients come in more knowledgeable than not. So I think it's becoming more mainstream just by my observations in the clinic. It's depending on a state also. Some states, it's still illegal for naturopathic medical doctors to practice. They can't be licensed there. And I'm not going to say illegal, but unlicensed. So if you're not licensed, you can't practice. There's, I think, 13 or 14 states or 15 states now that we can practice without any complications. That could be another determining factor. For example, it's very mainstream in Washington State and Utah and Arizona. You would see more naturopathic doctors than conventional doctors, but in California, not so much. So yeah. And others, there are some states that you might not find one or two. So.
Wow, more naturopathic doctors than conventional. That's
It's
exciting.
Yeah.
Yeah. One of the things that I wanted to say, and maybe as this is just my personal philosophy, but one of the things that made me feel really good about working with you was that you came in and looked at all of the work that I was doing with the conventional um, therapies and how to work with it. And as opposed to it's not, this doctor in this corner and that one in that corner, and they're not able to compare notes and compare realities. Um,
Yeah, that's a really good point. So my goal is not to complicate things with the therapies you already have ongoing. My goal is to clarify some questions that you may have, some even incorrect information that's given from the oncologist. Some oncologists are so cautious that they don't even want to take the time to even see if there could be any possibility, any room for these therapies that could be helpful. I had a patient that was getting treatments with me. This particular case was a pancreatic cancer case, and I really, the family was so dedicated to get this patient better, and they were coming in 3 times a week, and it was costly, both time and finances, right? But they were like, we need to do this for my father, and we're doing this. So they would come in, and within, I want to say within 3 months, the tumor had shrunk in half, and the hospital had, the doctor that was examining the patient after reviewing them, it just said, I don't know what you're doing, but you have to keep doing it because we don't have anything that could work with this. So as soon as the patient had said, well, I'm doing ozonotherapy or I'm doing these, they said, oh, I don't even want to hear about it. Right? Close that door right away. This is not a place in medicine that we want to see. I would rather be very honest and say, look, I don't know anything about that. It seems to be helping, and it seems safe enough that you're not dying from it. You're getting better, and your tumor shrinking. That's much better conversation to have. Or say, I'm not. Some doctors are now saying, I'm not knowledgeable about it. I don't know anything about it, but these are my concerns. So then the patient, those are better, right? So the patients will bring in those concerns to me and say, this is where his concerns or her concerns are. What do we do about that? So now I'll sit down and I'll review it and I'll clarify those concerns and say, I am very sure about this. This is something I haven't heard of. Let me look into that. And here's something that's just wrong. Yeah, that's not true, or this is true. So this is where I come in, right? Or doctors like me, we want to make things easier and not harder, and we want to clarify things. And I respect and I meet the patient where they're at. So if a patient says, look, I really want to do these therapies, but I'm fearful, I just can't do it because I want to go through these therapies and then maybe consider yours, there's room for that too, no problem. There's a place and time for everything for every patient. The patient has to be ready even to have that door to be open-minded for some of these cutting edge therapies. They are cutting edge therapies. They're kind of new in the market, but they seem to be helping, and we're learning more about them, and we're offering them, and we're getting people better.
Right. There were a couple of things that you touched on briefly that I was hoping you could say a little bit more about. You mentioned how one of the benefits of water is clearing toxins. And I was wondering if you could just talk a little bit more about some of the other benefits of water. And I think I understand that maybe as a cancer patient in the middle of treatment, you might want to have more than the sort of minimum recommended amount of water.
Yeah, so as I was saying, when you're going through chemotherapy, for example, chemotherapy lyses or kills cancer cells. That's the job of it. That's why you see tumor shrinking or things getting better, even though you yourself are not feeling better during chemotherapy. Because chemotherapy drugs are not so specific yet. That's the target here, is to go and only kill cancer cells. That's what we're looking for, but we don't have that yet, right? So these drugs not only kill cancer cells, but also will kill anything that's rapidly dividing in your body, like your gut cells, or anywhere in your body that you have a fast turnover, even your skin. That's why a lot of patients will have rashes on their skin while they're going through therapy. So what happens is, with all that debris, your body has to clear it. You have to get rid of it as it slows down. So your liver's overwhelmed. And so then it can't kick things out fast enough. All of a sudden you're not feeling well, or you're getting swelling in your legs or hands, or you're getting migraine headaches that you didn't have before. You're getting brain fog, right? It's feeling drunk, almost like I'm not myself. I'm sleeping all day long. That's because of the toxin overload. So there are therapies that I offer in the clinic that could be helpful, or saunas, infrared sauna, to help. So what you want to do is you want to open the channels of eliminating the toxins. That would be peeing, pooping, sweating, crying. So any avenue for fluids to come out, that's what you want to do. But you also have to drink lots of water to wash that out. So that's where it helps. It also helps reduce constipation. It helps prevent kidney damage. It helps your liver. It helps your skin, your hair, all of the above. So.
Okay. And then another thing that I know people can be a little bit afraid of is weight gain, and it's sort of popular in culture to cut fat to avoid weight gain. But I think healthy fats have some important functions. I mean, you mentioned brain health, which is,
Right.
every day of our lives. Are there some that are specific to, being in a cancer treatment or recovering from that?
Sure. A good quality fish oil would be very helpful. Some patients are vegans, for example, then I would say good seed oils. Quality. So what is quality? You want to make sure they don't have, they're screened for metals themselves. Fish oil, for example, you want to make sure there's no high mercury in it. So if you get a good source of fish oil, all that work has been done for you. So this is another reason why complementary docs are so knowledgeable about what product you need to use, what dosing you need to use. So fish oil or fatty acids, medium chain fatty acids, are so important in mental clarity, to get rid of the brain fog, and to help overall nervous system. They can also help prevent a lot of neuropathy. And also another thing that one of my big recommendations during chemotherapy, one thing you will see that's common is anemia, because you're suppressing the bone marrow also. So shark liver oil seems to be very helpful to induce the bone marrow to make more red blood cells. So anyone with anemia, I usually put patients on shark liver oil right away. So fatty acids are extremely important. Eating healthy fats. The weight gain would be more toxin overload, like I talked about, because when you have high toxins in your body, you're shutting down metabolic activity. So you're really shutting down your cellular activity, and everything is retaining in your body instead of being processed. So detox sauna would be far better approach, or walking every day, than reducing your fat intake, especially the healthy fat intake. I wouldn't do that. I would reduce sugar before I would reduce fat. That wouldn't be my recommendation. So.
Okay, fantastic. Yeah, I love the fact that you're looking at the whole person. You started off by talking about mind, body, spirit, and mentioned meditation and prayer, and um, these are things that aren't necessarily easy to find a discussion of in traditional literature with traditional medical practices. But I do think more and more people are starting to realize that it's important. It's just wonderful to have a guide to say, okay, now that you know that you want to go into this area, here's more of what you need to know about it. So
Yeah,
thank you so much.
oh yeah. One last thing, this is another thing that's not commonly talked about. I would highly recommend finding the right group support or therapy, not only for yourself, but also for your family. So the focus is always on the patient when there's a diagnosis, but the truth is your family is going through it with you. So this is something I always, the caretakers, I have a separate conversation with, and I say, you need to get support. You need to get a therapist. You need to do this because you need to be focused on your family member that's going through this, but you yourself have to stay grounded. You know, this is very important. That's something that's not ever talked about, because our job is to focus on the patient in front of us, but that's equally important for the patient to get the appropriate support. So that's another last minute plug-in I want to talk about. Well, thank you so much for inviting me. I really appreciate it. And I
This
hope
has
to
been
hear.
fantastic. Yeah. And we have some contact information for you as well. And if there's anything that doesn't overlap, if you would kindly put your slides down, we'll put ours back up. And there we go. So here are some options for how to get a hold of Dr. Santiago. And you can also literally just Google her and in Pasadena, California. And that comes up with an office address and phone number, which I think were on your slides as well. So,
That's right.
yeah.
And I also put our office phone number in the chat, text messages, so you also have it there. So yeah, if you have any questions, please
Great.
contact me. I'm happy to help. Thank you.
Great.
All
Thanks
right.
so much.